the last three speakers, Professor Ann Mills, Dr. Mutaj Chaudhuri, and Professor Paiboon Turiya Wong Paisan. So please come to the podium, to the panel. This morning I mentioned that Professor Ann Mills got her award, the Prince MAHIDOL Award in 2010. And probably she's the only one, non-medical doctor to receive this award in medicine. Probably. And and now just recently I heard that she is now decorated as a Dame Anne, right? Dame Anne. I don't know how to greet you anymore. But thank you very much for accepting to give us a presentation on the governance of universal health coverage in Thailand, right? You are going
in Thailand.
Because you were a member of some sort of evaluation team of this office once. So, Professor Mills, please.
Thank you very much. I really liked Professor Ammar's comment earlier that I think he suggested DIY approach or views on governance, and that's very much the same for me. I don't regard myself as an expert on governance, but it's a very important issue, and so I welcomed the opportunity to think about some reflections. So before the break, I think I heard three different approaches or concepts of governance. I heard governance as, in a sense, a broad, coordinating, policy-setting function. I heard governance as an accountability mechanism for organizations, as Dr. Vinai talked about. And then we heard governance as resource allocation from Professor Ammar. And I think my comments are going to follow up more thinking about accountability mechanisms, building on what Dr. Vinai said. So I've been acquainted with Thai health development over 25 years now, but I'm still learning. And although I was part of the independent evaluation, the 10-year evaluation of the universal coverage scheme, I still, there are some aspects of the system that I'm not so familiar with, so please forgive any misunderstandings of mine. So I've been asked to address the governance of universal health coverage, and by that I understand the combination of the universal coverage scheme, the social health insurance scheme, and the civil service scheme. So the independent evaluation mainly focused on the universal coverage scheme, not on the other two. So in my comments, I'm going to go a bit beyond what the independent evaluation concluded. And so, just as a final preliminary comment, these are very much reflections and from someone with an economics background rather than a broader political science or social science background. So I think that will sort of flavor my comments. So what might one expect from a government structure, from a governance structure? I think three main things. One is to ensure accountability to the appropriate authority. And I think for public governance mechanisms, one expects there to be both upward accountability to higher levels of authority, and some element of downward accountability to the people that the organization is wishing to serve. The second element of governance is that I think the arrangements should ensure to the best of their ability criteria like effectiveness, efficiency, quality, humanity, we call it in the UK, you can call it responsiveness, safety, and so on. So to assure various characteristics of the health system. And then thirdly, criteria is to ensure transparency of decision-making, avoiding capture by particular interests. So those three elements, ensuring accountability, ensuring characteristics of performance, and ensuring transparency, I just want to reflect for a few minutes on how well those elements of governance are reflected in the arrangements in Thailand. So my first comment, in fact, Professor Ammar has already said what I was planning to say, which is to do with the accountability of the universal health coverage system, i.e. the combination of all three elements of the universal coverage system. And where is that located and to whom is it accountable? And I think it was clear to me, and certainly Professor Ammar made it very clear before the break, that there is essentially a vacuum at the centre, that there is no systems governance above the level of the individual elements of it, the NHSO, the Ministry of Labour, the Ministry of Finance, the Ministry of Public Health. And I think that's a major concern. Clearly, the National Health Security Office, its accountability, its governance mechanism, the National Health Security Board, has its own responsibilities. The Ministry of Public Health, which one would look to for systems governance, still has this unresolved tension between its stewardship role and its role as the manager of the majority of health facilities within Thailand. So I think that that issue of system accountability is a key weakness. So then in relation to the different elements of the system, of their accountability, clearly each of the different elements have their governance mechanism, the National Health Security Board, the Ministry of Finance, the Ministry of Health, and so on. And then that raises the question of how well their particular accountability mechanisms function. That I'm not really well qualified to say, and I think I'll put that out as a reflection to all of you on how well the upward accountability works. I want to comment about downwards accountability, because to my mind, the Thai system is still very centralized. Downwards accountability, accountability to the population, is emphasized more by an emphasis on managing complaints and views via the hotline, for example, of the NHSO. That's laudable, that's good, one needs that, but it's not enough. And I think from experience in other countries, one would expect some form of representative governance at the lower level, whether that's civil society engagement in governance of purchasing organizations or of hospitals, whatever, but some form of engagement with local bodies that helps to achieve some measure of downwards accountability to complement the upwards accountability that one also needs. So my second element of governance was ensuring desirable characteristics of the health system, efficiency, equity, and so on. So on the efficiency side, I think what the governance body needs to assure is a good design that ensures cost control while still maximizing performance. So I think there are some good elements within the Thai system. The National Health Security Office has acquired good experience in managing its core payment systems and appears to be able to nuance that through additional elements to incentivize various elements of performance. The social health insurance system, its core payment mechanism, the capitation, makes sense in its context. Professor Ammar commented on the lags in its ability to respond to changes in the context that it's dealing with. And CSMVS, again, Professor Ammar commented on aspects of the payment mechanisms. There have been some reforms, but there's still scope to do more. So there are some mechanisms to ensure efficiency within current arrangements and some good aspects of the payment systems. But what I worry about the aspect of efficiency is, again, this separation into three main funding arrangements. And of course, in addition, there's the Ministry of Public Health, which is funding the basic infrastructure. And that, to my mind, must create quite significant problems in managing the system efficiency, whether that's at the overall level or whether it's at any particular hospital which is facing a number of streams of funding from various sources. So I think that's a concern I have on the efficiency front. On the effectiveness quality side, I think Thailand has seen some good developments, like the role of HITAP in assessing new drugs, diagnostics and interventions. But again, I feel that actually improving the effectiveness of the system is again hampered by this division in the way that it's funded and in the lack of oversight at the system level to assure an overall view of the effectiveness of the whole system. Any health system needs a system to encourage clinical audit, to reflect on and analyse the performance of health facilities. And I think the tripartite arrangements don't make that easy within Thailand. Other aspects of the characteristics of performance, like humanity or responsiveness, I think a lot of positive things have been said for how the system works within Thailand. Safety, I'm much less aware of how assurance of safety is done within Thailand and whether that receives sufficient emphasis, whether that's areas like antimicrobial resistance, problems of hospital-acquired infections, and so on. And then my third element of governance was transparency, the important criteria of transparency. One can look at that in different ways, but one of the things I want to focus on is transparency of the functioning of the arrangements, making data available to others to analyse, understanding what's going on within the system. And here I think that although a very large amount of data is collected, there's far too little attention paid to data quality, that there seems to be a feeling within Thailand that data is data and that data tells you what it's meant to tell you. In my knowledge, any country that has tested the accuracy, reliability, and validity of its data within its health system has found major problems. So I think that on the transparency front and the data side, I think a lot more effort needs to be made to check the data and to use the data and to make it publicly available for others to use, obviously with suitable protection on anonymity. So, in conclusion, I think a couple of the things that need greatest attention within Thailand in the area of governance. The first is to strengthen downwards accountability, to help to counteract the strong centralisation tendencies, and the second, to improve data quality and encourage widespread use of data to help assure effectiveness and quality. And my question is, whether maintaining this tripartite arrangement of UCS, SSS, CSMBS, plus the confused role of the Ministry of Public Health, is it difficult to make adequate progress on accountability and on governance without actually addressing that core problem within the existing system and the lack of an overall systems governance structure at the moment? Thank you.
I thought some of the issues raised earlier were provocative. I think this raised even the discussion into the next level. I think the conclusions and the issues you have brought, especially at the end on the download accountability, on data, and questioning what are the real challenges in the tripartite arrangement versus transparency. I'm sure would raise a lot of discussion later on. And now we can invite the next participants.
Yeah, no, not next participant, but next speaker. But I'm very pleased to see that the chief of the advisor to the Minister of Health is sitting in this room right now. I think he will gain a lot of benefit from, I mean, maybe we can gain from him benefit on this issue. He was the Minister of Health of Thailand also. So he was the one that we are blaming, or supporting, or praising, so sorry to say. The next speaker is the Dr. Mustache, right?
Yes, Mushtaq.
Yeah, that's why I see your mustache. Governance of health promotion. So, Professor Mustache, please.
Good morning, everybody. Respected chairpersons, panelists, and distinguished ladies and gentlemen. It's a real privilege and honor for me to be here today. And thanks to the organizers of this side session for inviting me. I myself spent 4 years in Thailand, and one of the major kind of rewarding experience that I had was to spend some time with the Thai Health Promotion Foundation, which is popularly known as Thai Health. And I was also involved in the 10-year evaluation of the Thai Health. So it's it's kind of a coming home and talking about something that I did a few years ago. But I will try to do justice whatever I can, of course. What I'm going to do is to talk a little bit about Thai health for the benefit of those who are not aware of what it is, and then also move into talking a little bit about the governance system that Thai health has developed over the years. So Thai Health or Thai Health Promotion Foundation was founded in 2001 by an act of parliament, which is called the Health Promotion Act of 2001. The mission of Thai Health or Thai Health Promotion Foundation is to support health promotion movement in Thailand by promoting the initiative, enthusiasm, coordination, and also the mobilization for health promotion. And there are many other actors who are also working in health promotion in this field. But the purpose of Thai health is really to act as a catalyst or what they call the lubricant, not as an initial substance or fuel for health promotion. Thai health's income actually comes from the sin tax, which is about $120 million every year, and it's the 2% surcharge excise tax that is levied on tobacco and alcohol. And this is quite a significant amount of money, which is about 4% of the total budget or the total expenditures of the Ministry of Public Health. So how does Thai health works? It works with different population groups in order to reduce inequity, as they say, such as the working adults, the women and children, and also the disadvantaged groups. They also work with different organizations and also in different settings all over Thailand. In terms of what are the risk factors that they work on, it includes things like alcohol, tobacco, road accidents, and also unsafe sex. And in terms of the health promotion factors, they promote exercises and healthy food. Now about what has been the impact of Thai health. Obviously, this one shows that there has been a 19.7% decrease in consumption of alcohol at a harmful level. But we have to be careful about the interpretation of this data, because it is not an attribution. It probably shows that how Thai health has been contributing to this reduction, because there are many other actors who are also working in health promotion, and Thai health is probably a significant part of that contribution. As I said, that I was part of a 10-year review of Thai health, which had about 7 members, and that was done in 2011, about 3 years ago from now. And 4 of the findings of that review were the following: that it has been able to attain financial sustainability, which is obviously clear. The money is coming from a defined source. Also, it has been made a platform for multi-stakeholder involvement and also intersectoral collaboration for health promotion. Thirdly, it has been able to initiate many cutting-edge innovation. And finally, it has been, as the evaluation or the review has found, it's been quite outstanding in policy advocacy and social marketing. Now, coming to the governance of Thai health, I must say that the Thais are very smart, and the governance structure that they have developed for Thai health has also been quite smart. This is a picture of the total governance system of the Thai health governance, but I'm not going to go into the details of everything. I want to devote my attention to 2 things. One is on the top left-hand side of you, which is the executive board of Thai health, and on the right-hand side, upper right-hand side, the evaluation board. And one of the conclusions we had from the review was that the kind of thing that the Thai health has been able to do has much to do with the way the governance has been organized. So on the left, we have the executive board, which is the highest policy making body and the governance of the governance board. And as you can see, that the chair of this executive board is the Prime Minister. And having the Prime Minister has been quite a smart move in this, because this puts the organization as a high-level organization, quite equivalent to a ministry. So this gives the credibility and also the power, if we can call that, to the organization. Being the chair of the executive board, the Prime Minister also protects Thai health from time to time as the political change happens. And we know that over the last 10 years, for example, or 12 years, there has been a number of general elections, probably 6 general elections, and there has been 2 coups between 2001 and 2014. But Thai health survived. It really didn't affect the way the Thai health works. They also have the Minister of Public Health as the first vice chair of the executive board, which also helps to forge a very strong link with the Ministry of Public Health. In our knowledge, no other health promotion foundation anywhere in the world has such a high-profile kind of executive board, and in many other countries, they are quite vulnerable to funding cuts. For example, in Australia, they have the Victoria Health Promotion Foundation, which has actually suffered a lot of funding cuts in the recent months. The second vice chair comes from a respective background, who is the very credible person, and also the executive board also has representatives from different sectors. So having those people also in the board helped pursue a very broad social agenda for Thai health. But involvement of different actors in the governance is not very new new here. We know that the Global Fund for which supports countries to fund the TB program, malaria, and the HIV programs. They also make sure that before a country applies for funding to the Global Fund, they also have to have SCCM, the country coordination mechanism, which also has to have representatives from all the stakeholders, including the civil society. But in this case, in the case of Thai health, this has worked quite well. But having people from different sectors also brings in risks of conflict of interest as well. And I will come back to that because we also try to look at that as well. Going to the second unique feature of Thai health is the setting up of the evaluation board. The evaluation board is an independent entity and is not responsible to the executive board. It is responsible directly to the cabinet. So this gives it quite a freedom to do whatever they want and also look at whatever they want to see. The evaluation board is headed by a very well-respected leader in this field, and currently it is Dr. Thapkorn, who is a respected economist of Thailand. There are also 6 other members who come from different sectors and disciplines. The terms of reference for the evaluation board is to assess the quality and effectiveness of Thai health governance and operations. But the evaluation takes place at a micro level. They take a micro approach to that. So they ask questions such as, is something is working? The kind of thing that is it working? Does this approach need more action research, or is there enough socioeconomic cost benefit and value for money evaluations embedded in the system? The evaluation board also takes a very special interest on governance as well. So one of the recommendation that came out of the 10-year evaluation was to do more on the conflict of interest kind of thing. How the board is really looking at the conflict of interest. And in 2013, the evaluation board set up a subcommittee to develop evaluation criteria for good governance. And in 2014, last year, the Thai Health also did an evaluation based on those criteria which were developed by this subcommittee to look at how the governance is being done and how good it is. The criteria included things like whether there is an absence of conflict of interest on issues like accountability, participation, transparency, adherence to the rule of law, and also the adherence to the principles of integrity. The evaluation board and the subcommittee are now collecting information on that, and this will be done on a regular basis. For example, in conflict of interest, there has been no violation of that they have found with respect to the conflict of interest guidelines, which were reported last year. But the challenge for the subcommittee to do this in a very objective way is there, and also once the findings are found, how those are acted upon. So that remains to be seen. The 10-year review also elaborately reviewed the evaluation board and also its potential to be more effective, to provide good governance. One recommendation was about creating a position of ombudsperson. And we know that in many organizations around the world, including my own BRAC, we have ombudsperson. And if anybody who is affected by the act of the organization, be it on the staff or the organizations that it works with, or even the population, they can come back to the ombudsperson for redressal of the grievance. So these are kind of things that Thai Health would benefit by having in its fold. Finally, I must say that Thai Health is an important innovation that has been done in Thailand, and is a great gift from the people of Thailand, to the outside world, like the universal health coverage. So thank you very much for my.
Thank you very much. Actually, I expect to learn more from you about the governance of health promotion itself, which means that it's a broad area of activities, but not just to learn about health promotion organization. Because if you look at this in this folder, you see that Thai Health Promotion Foundation is there, but the health promotion itself may involve many other key players as well, and it should be interact within what we call the governance of health promotion itself. But anyway, at least we learned one important agency dealing with health promotion of the Thai people. So maybe we can have time to discuss more about the interaction of the Health Promotion Foundation with others, and also the other sectors working on health promotion in the country. But we don't have enough time to look at the governance of all agencies involved. This morning we learned about the National Health Security Office, and also Ministry of Health, and a few others, and also Professor Ann Mills mentioned about the high-tech activities. For example, there are many other independent agencies in the government not under the direct control of Ministry of Public Health. Okay, can you introduce the next speaker?
The next speaker. Now I realized Dr. Wiwat was challenging me on pronunciation of the name, so I would shy away from that and ask Professor Paibul. You see, you got me again. To look into governance of participatory healthy public policy. I think this is where I hope you will bring all the discussions of how the various systems ensure a good, healthy public policy. You have the floor and the challenge.
First of all, I wish to thank the organizer of this meeting and the Health Commission for picking me up to share with you, which I do not share with the moderator, the burden that he's trying to put on me. That's too much. Let me start by amplifying the do-it-yourself definition of good governance bring up by Professor Ammar. a little exercise, I compare the definition of good governance using the UNSCAP, sorry, not UNDP, as a framework reference. And you can see in this slide among 3 others international agencies, there is no such a consensus on the definition of what means by good governance. So this may indicate differing ideology and principle underpinning power struggle in politics, globally and locally.
What did the yellow color mean and the green color?
Green color means strong agree, yellow color somewhat agree, and the blank space is no agree. Thank you. So let me put the good governance into Thai context. It was argued that today public governance has been mainly influenced by the World Bank good governance concept. This is Thailand, okay? And according to Professor Phasuk Pongpaichit, one of the well-known political scientists in Thailand, good governance under the World Bank framework was considered a better legal framework to ensure transparency and accountability in public administration. The adoption of the framework was a top-down exercise. This author inserted that Thailand's recent experience about good governance deal with political reform and social movement. I don't need to give many examples. The current governments coming from coup d'etat is a good example of how Thai do the political reform. And to my understanding, these were initiated mainly by political elites, including the bureaucrats. In order to share selected Thai stories of good governance and the development of healthy public policy through participatory approach, this is my assignment. I will use the lens of innovative public governance proposed by Anti-Roigo. In broad sense, the meaning of good governance under the lens encompasses transparency, participation, accountability, etc. The performance of good governance was considered under the influence of globalization, democratization, localization, and marketization. This analytical framework fits well with the following facts. First, the influence of the World Bank and /IMF on member countries could be a good example in terms of how globalization affects public governance. Second, research in political epidemiology recently provide evidence on the linkages between democracy, public governance, and health outcomes. Thirdly, in the UK, Lawton and Macquarie reported changes in local governance as a result of the Localism Act 2011. And finally, the contracting out to private operator under a public-private mixed model was shown to ensure efficient use of shockwave lithotripsy in Thailand by Tang Charoen Sasien et al. Several years ago. Now let me start with the first story to share with you on my personal account of tobacco control in Thailand. It has been globally recognized as a success story and been used to inform relevant public policy decisions in a number of developing countries, such as Mongolia. Developed to a large extent, the success was a result of well-informed social mobilization at national scale, with episodic linkages to the global community started 30 years ago. One of the historical landmark records for this social mobilization is the collection of 6 million signatures to support the value of smoke-free society. The across the signature were gathered by several 10,000 of runners from all walks of life organized across all geographical regions of the country. When global trade forced Thailand to open its monopolized tobacco market, this threat was turned into opportunity. This is a strategic work by health professional leaders form alliance with global anti-tobacco experts. The opportunity was exploited to further strengthen national alliance, especially politically influenced public agencies, that is the Ministries of Finance, Commerce, and Foreign Affairs. Another landmark success was the enactment of one of the most comprehensive legislation on tobacco control in the world. This was in fact achieved within a short time frame as compared to those of developed countries through making use of accumulated momentum of the social mobilization, enabling successful exploitation of windows of opportunity emerged during coup d'etat governments such as the present. Nonetheless, a new challenge arises as indicated by the downward trend of tobacco use hitting the floor, shown in this slide, plus sustained urban and rural differences in smoking rate.